The Mid-South is in bloom. While it looks pretty to see nature wake up from its winter hibernation, many of us know it can also bring some major issues in the form of allergies. In fact, the Centers for Disease Control reports up to 60 million people a year battle seasonal allergies. WRG's Shay Arthur is live tonight after speaking with a doctor about what we all need to know. So, Shay, what is he telling you?
Hey, Greg. Well, as we all know, those who suffer from allergies know they are no fun. And as for treating them, the doctor I talked to has a message and a warning tonight. Spring is here as we welcome a new season 2, allergy season. With that comes symptoms like sneezing, itchy, watery eyes.
Welcome to Memphis. You know, that's all I got to say.
Millions in America affected.
Children to older adults as well, everyone is affected.
Dr. Mark Castellaw with Baptist Medical Group says he's seeing patients with sinus and allergy issues, but imagines there's many more who don't see a doctor and treat themselves with over-the-counter medicine. Tonight, he has a warning.
You need to be extremely careful about mixing over-the-counter antihistamines and decongestants with any prescription medicines.
He urges people to check with their healthcare provider before taking over-the-counter medicine to make sure it's safe to mix with any other medicine you're taking.
Like blood pressure medicine, heart medicines are the ones that are biggest risk for you to be using over-the-counter medicines without getting your healthcare provider's permission.
He also says it's important to monitor symptoms.
But the older folks, what you're concerned about the most is things can start off as an allergy episode, but turn into a severe sinus infection. If your symptoms are prolonged, if you start having colored discharge or start running fever, or anything like that, you need to contact your healthcare provider.
Another thing to remember, symptoms could be similar to COVID, urging people to get tested, just in case.
Today, I saw 2 patients that had typical allergy-like symptoms, but something just didn't seem right, and both of them had COVID.
He says prevention is key. There are ways to limit your allergy exposure, like avoiding being outside during peak pollen times. If you're working outside in your yard, wear a face covering. After you get indoors, change your clothes. They could be carrying pollen. And check your pets. They could be pollen carriers too. So, Greg, that pollen count typically reaches its peak midday, early afternoon, making those allergies worse. For your news leader, we're live downtown tonight. Shay Arthur, WREG News Channel 3.
All right, thank you, Shay. So beautiful when everything is in bloom, like that tree behind Shay.
Yeah, my eyes started watering just looking at it. Yeah.
Just looks yellow everywhere right now.
But you know, rain is the surefire cure for some of this pollen.
It is. Usually it can temper the pollen issues, kind of wash everything down the drain. Unfortunately, there's no meaningful rain until the weekend. When